Hey, my name is Dr. Cozy. It's really nice to meet you. And I see that we have you here because you've been feeling a lot of pressure and discomfort in your ears. Okay. You've had a runny nose too. Okay. Well, really quickly off the bat, let's get a temperature, okay? Just need you to open for me. Perfect, and it just goes right under your tongue. Okay, close. Okay. There's a little bit of an elevated temperature here, under 1.4. Oops. I got all of the otoscope covers. Okay. I'm going to take a look inside of your ears, okay? Let me know if anything is tender or uncomfortable at all. So, feel me pulling your ear back just a little. Okay. I am seeing some redness, but there's also a lot of cerumen in the ear, which is blocking my ability to really see what's going on here. Check the other side as well. Again, you're going to feel me pulling your ear back just a little. And okay, I am seeing the same thing on this side. There is a little bit of visible redness, but my view of your tympanic membrane and the majority of the internal structures are occluded, because there is quite a considerable amount of wax in each ear. So we will need to do a bit of just a gentle ear cleaning just to try and remove some of that so we're able to see what's going on. I'm going to take a quick peek inside of your nostrils, okay? So, this side. Yeah, I'm seeing some drainage. Put the ear one back on. Just keep your eyes open for me for a moment. Your eyes bugging you at all? Yeah, they're a bit red, and it looks like you've been having a bit of tearing occurring as well. have you open your mouth for me? Great, thank you. Oh yeah, we've got some marked postnasal drip occurring here. Back of the throat is quite a bit red. Just gonna push this against your cheek. Okay, on the other side. Now I'm going to palpate your external throat here. Feeling for any lymph nodes, inflammation. Yeah, right off the bat I'm feeling some submandibular nodes. Some submandibular, cervical as well. No clavicular though. Gonna feel under your arms real quick here. Sorry, I know it tickles. Okay. We're good there. No axillary either. So when did your symptoms start? Okay. Alright. Did you try to take any medication? Have you tried using any kind of hot pack, steam, anything to try and alleviate the symptoms? Okay. Has any of that been effective? Are you experiencing any other symptoms such as nausea, vomiting, chills, night sweats? Okay, some chills. How about any ringing in your ears? Any dizziness? Difficulty hearing? How about any pain or crackling when you swallow? Okay. And is that on both sides? Have you been tracking your temperature at all? No, okay, that's fine. Just check your medications.
This says you don't have any medication allergies. Is that accurate? Okay. Just need to check in case we need to prescribe an antibiotic. Okay. So like I said, your ears are a bit clogged with some wax, but I do suspect that we have a case of otitis media in both ears, which is basically a bilateral ear infection. I will be needing to do a gentle ear cleaning to confirm this. But first, I do want to do a quick hearing test just to verify whether or not there is a loss of hearing occurring, okay? Okay. So I'm going to whisper some numbers in each of your ears, and I'd like you to repeat back for me what you hear. So we'll start.
89, 44, 63. Okay. 16, 27, 92. Good, all right. 89, 76, 8. 51, 32, 14. Okay.
Now close your eyes for me, please. Tell me when you feel, or when you hear rather, my hands tapping, getting closer to your ears. Good. 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 All right. You can open your eyes. So it does appear that your hearing is unaffected, which is good. It sounds like you've been on a plane and you can't quite pop them. Okay. Alright. Well, first off, we're going to do a cleaning, okay? And just get a tissue ready. I'm not going to use any water because if there is fluid inside of the ear and marked inflammation, we don't want to exacerbate it. So let's start. I have these very, very tiny, very gentle kind of a Q-tip here, okay? I'm going to use. Should not be uncomfortable. And then depending on what I'm able to extract using this, we will potentially revisit with a brush or a pick. So, I'm gonna start, okay? doing what we need. I'm gonna go in with a brush now.
Try again. It's doing a bit better. Going on the other side. Okay. There's just a little bit left. I'm gonna go in after using this little curate. If you see, it has a little loop that I can use to kind of go in and drag these stubborn bits out.
Oops, sorry. Take a look again inside.
Okay, yeah. So your ear canal is looking quite a bit inflamed and irritated. Tympanic membrane, which is your eardrum, is definitely involved. It's quite red and angry looking. And I do see there is some fluid collecting in the ear. Take a look at the other side. Though I suspect we're going to see the exact same thing. Yep. The ear canal here looks really irritated on this side as well. There is a marked amount of fluid collecting around the tympanic membrane. And this one is also quite angry looking. I can tell you're definitely not feeling too great. So let me just take a quick note, and then I'm going to try something that might encourage some of that drainage to evacuate the ear. But just a sec. What I'm going to do is activate a couple of heat packs here, and then I'm going to hold them over both of your ears. And usually heat can cause vessels to dilate and allow a larger passage for drainage to travel through. Okay? So I'm going to put a protective cover over it so it's not too warm on your skin. And one more.
are kind of stubborn because they're exactly the width of a heat pack. So I'm going to put these over your ears now, okay? How's that? How's the temperature? Okay. If it's too warm, let me know. I can wrap them in a drape. Okay. Let me know if that changes. Still doing okay? Okay. Okay. Yep. Let's go ahead and clean that up. I'm gonna lightly do a bit of a lymphatic massage, which is going to help give you a little bit of relief, okay? And I want you to try and remember what I'm doing so that way you can do it for yourself, because it does reaccumulate that congestion. So understanding how this works can be really helpful. First, I'm going to activate the glands under your neck, under your ears. Okay. And then lower down here at the base of the neck. Okay. I'm going to just be using feather light strokes from the base of the ear to the neck, to the base of the neck. if you do that a couple of times a day, it should help you start to feel some relief, okay? So, given the nature of the drainage that I'm seeing and the amount of redness and inflammation I'm seeing in each of your ears, also along with the fact that you have some pretty prominent lymph nodes present, that really sounded like a tongue twister, didn't it? I am going to prescribe you an antibiotic. Have you ever taken amoxicillin before? Okay. Did you feel like you tolerated it pretty well? Okay. So that's usually the one we pick for an infection like this. Sorry. I definitely gave myself a tongue twister situation there. So I'm going to have you take it for 7 days. You'll take it twice a day, morning and evening. I definitely recommend taking it with food. You'll feel better in terms of digestion. It's very important that you take every dose and that you finish the medication. We don't want to put you at risk for antibiotic resistance. So always make sure our patients understand you want to take and finish your antibiotic doses always. Resistance is not a good time. So, okay. I have your pharmacy here is the CVS on Main. Okay. All right, so I'm going to pass that off to one of my medical assistants to have them call into your pharmacy, okay? Along with that, you're going to want to use systematic relief, so anti-inflammatories, heat packs, lymphatic massage, and actually nasal spray can help as well, okay? At the end of the antibiotic treatment, if you're still having some symptoms such as a little bit of a runny nose and some throat irritation, some residual pain, that's totally normal and will eventually clear up. However, if you are continuing to have an elevated temperature, those chills are still persisting, you're still having that crackling when you swallow or any kind of pain or diminished hearing, then I want you to come back in and we will reevaluate. Okay? Okay. Do you have any questions for me before I step out? Yeah, so these heat packs can be found in the first aid section of most pharmacies. I know for sure they have them at Target, so definitely worth taking a look for those. If you're not able to find them, then you can also use a washcloth if you just run it under some hot water. Okay? Okay. So I will be giving you a call tomorrow to see how you're doing and make sure that you're doing okay. All right? And last bit, the phone number I have here that you wrote down, is it okay for us to leave a message? Okay. We don't leave any kind of details. We'll just say that we called, and if you can please call us back. Alright, well, whenever you're ready, feel free to depart, and I hope you feel better really soon. You take care.